Thanks, Julie. Well, the district's HIV/AIDS prevalence rate still at an epidemic level, but the number of new AIDS cases and deaths in the district have declined in recent years, according to a new report by D.C. health officials. Joining us live in studio this morning to talk about the findings, Dr. Shannon Hader, director of D.C.'s HIV/AIDS administration. Dr. Hader, good morning.
Good morning.
Thanks for coming in. Now, the report has some really promising good news in it. Let's talk about the work that still needs to be done. First of all, D.C., the numbers still at more than 3% affected by HIV/AIDS. Still work to do.
Absolutely. You know, HIV/AIDS is a serious problem, especially for the District of Columbia. It is, we're a place where this has become a really common disease. When over 3% of the population already has HIV, that means we have a lot of work to do. We have work to do both to prevent new infections, but also to make sure everybody who's already infected with HIV can live a long and healthy life. And I think that's what's promotes optimism from this report is for the first time across the district, we're seeing some of those gains. We're seeing fewer people die of AIDS. We're seeing fewer people progress from HIV to AIDS. Those are really good signs that we're starting to make a difference.
I was surprised, though, by the age. It started at 12, to adulthood. And of course, there are many different ways to contract HIV/AIDS. But that was a sad little side note for me to hear the number because, yes, there are medicines and treatments for this disease, but it still has to be treated and thought about every day.
Absolutely.
Yeah. Okay. Let's talk about some of the specifics here. The good news, really, the number of new AIDS cases has declined by 33%, 30% decrease in D.C. residents dying again from the disease. Want to end it there because I want to talk about some other things, but that's some really bright moments in this new report.
Yeah, I think what it helps us do is to say that our efforts in the district are working. And that actually brings us to the next level of saying we know things are working. This is not a futile problem. And in fact, we should redouble our efforts and continue to move forward.
Right. What I also found was interesting, some have said that we know these numbers because more people are going out there and getting tested now. So when you hear that 3% figure, that's a terrible number, of course, but maybe the other side to that is, well, people are finding out their status.
Absolutely, because the thing is, the only numbers that count in this surveillance system are people who've been diagnosed. And we know a lot of people, because of the nature of HIV, you can live with HIV for many years without any symptoms, without knowing about it. So unless you've been tested, you can't know that you don't have HIV.
Right. What do you credit that great number, that 30% less dying? I take it that's just treatment. Also, but the new case is going down. It's working somewhere.
Yeah, well, one of the linchpins of our prevention and treatment programs is actually HIV testing. And the district about 2.5 years ago became the first jurisdiction in the country to make a policy of routine opt-out voluntary HIV testing in medical settings. So going from policy to implementation, what that is we really want getting an HIV test once a year to be as easy and usual when you go to a doctor's office as getting put on that scale for obesity, getting your blood pressure checked for hypertension. And we're making progress in that.
Right.
And when a test becomes routine, we find that people are finding out their status earlier in the course of disease. We've seen our success in getting them right into HIV care increase, and that all plays to this improvement in these numbers of less people getting sick and dying from end-stage untreated disease.
Talking about the specifics, Doctor, of the epidemic, still African Americans, that number is just off the chart, disproportionate to other groups. What's the problem here still?
Well, it mirrors what we're seeing nationally, which is racial health disparities, particularly in HIV/AIDS. So in the district, about 55% of our population is Black or African American. About 75% of our HIV cases are. Yeah. There are a couple of things that lead into that. Number one is I think we still suffered in the district for many years from an outdated perception that HIV from the early 80s, perhaps, is only a disease of gay white men. And I think if you don't think that you're at risk, you don't necessarily take precautions to protect yourself from HIV. I think second, there's also an issue here with traditional lower levels of access to health services, these kind of structural determinants. Right. And so again, for a disease that you don't know you have unless you've been tested for it, we need all of our residents and all of our African American residents to be empowered to not only access healthcare services, but to feel, empowered to say, hey, you're my doctor, you should be offering me an HIV test. And so when I go to the doctor, I asked for an HIV test because I want it to be offered to everyone.
All right. I have to end it there. The other points of it, chlamydia cases have doubled. Number of new TB cases decreased by 36%, though. So, and the number of people living with hepatitis C or B are both about 15,000 in the district. Thank you so much for being with us this morning. We appreciate it. It's Dr. Shannon Hader, Director of D.C.'s HIV/AIDS Administration. Steve, over to you.
Allison, thanks. 8:22 right now on this Thursday morning. They are heavy. They are